So I made a video recently talking about Dr. Ellie Phillips' complete mouth care system, and that video got a lot of attention. A lot of the comments on that video were talking about how great the system was for them, but actually it seems like there's a lot of people out there who are using the system but swapping out certain bits that they don't actually like. I also had quite a few comments from people who live outside the US who couldn't get some of the products and what are the alternatives they could use. So the aim of this video is to take all of those comments, discuss what people have already been using as alternatives and what you may be able to substitute some of those products that are maybe a little bit more difficult to get. So the first step of her system is to use xylitol gum. And I've already talked about xylitol a lot in the last video and how it can do a lot of good stuff for your dental health. One of the main features of Xylitol's gum is the 100% pure xylitol. The gum that I used in the last video was called Pure Gum, and it also has 100% xylitol. So I'd have no problem recommending that as part of the system for this step. If you're not sure about what you should be using, probably the easiest way to get around that is to use xylitol crystals or a xylitol powder. What you could do is you could mix that in and make a little rinse for yourself. Mix it with water, or maybe coconut oil would be better, and rinse that after you eat. I suppose that's probably not as practical as having a gum or a mint, but these would be the easiest things to get a hold of. I also just want to reiterate again in this video that xylitol is actually poisonous to dogs. So if you do have a dog at home, just be very, very careful that they don't get a hold of the xylitol. I also found that when I was using it, that it gave me quite an upset stomach, so you may have to tailor your dosing accordingly. So the next step then is using a Flossing mouthwash, and the main aim of this step is to neutralize any acid that's in the mouth before you start to brush. They're thinking that if you start to brush your teeth with an acidic environment, the teeth will already be demineralizing or softer. And so if you go brushing with a hard toothbrush or brushing very aggressively, then that can start to damage the enamel and cause more issues further down the road. Flossing itself is a nice mouthwash. It can be quite difficult to get outside of the US. So if you're planning on using something else, probably the easiest thing to use here is just water. If you rinse water around your mouth for 30 seconds, that will neutralize any differences in pH in your mouth. If you are concerned about the acidity of your water generally would have a pH between 6.5 and 7.5. The critical pH in your mouth needs to be under 5.5 to start to cause demineralization. So there's plenty of room there that makes it safe. So when it actually comes to brushing, Dr. Ellie is recommending using a hard manual toothbrush with Crest cavity protection toothpaste. Now, I don't have an issue there with the toothpaste. It's absolutely fine. The problem is with the brush. I personally use an electric sonic toothbrush, but it's also completely fine to use a manual toothbrush. You can get just as good results with a manual toothbrush. I would recommend a brush with softer bristles, and make sure you're changing your brush every 3 months or when the bristles start to get worn or splayed. So part of the claim of using this hard toothbrush is that it's going to stimulate your gums and start a process called angiogenesis. It's thought that this will stimulate stem cells there, which will encourage your gums to repair themselves. I personally don't agree with that. I don't see that there's any evidence out there to say that this actually happens. In fact, I think the opposite is more likely to be true. If you're brushing your teeth aggressively with a hard toothbrush, it is going to cause damage to your gums and to your tooth enamel. The Sonicare toothbrush that I have has a pressure sensor in it. It also uses sonic vibrations that will also stimulate your gums safely. And it's a more efficient way of cleaning your teeth than with a manual toothbrush. In terms of toothpaste, the toothpaste that I use is made by a brand called Kin, K-I-N. Their everyday toothpaste is called B5. It's called B5 because it has vitamin B5 in it. I don't actually think that the vitamin B5 does anything for your mouth, but the reason why I use it is that it's SLS free, it's got the right concentration of fluoride, and it's also got xylitol as an active ingredient. I know some people are a little bit wary of using a fluoride toothpaste, and if that's the case, if you want to go fluoride free, you should use something like one of the nanohydroxyapatite toothpaste. I actually just made a video recently explaining how that works against fluoride. But the main difference there is that fluoride will repair your teeth with something called fluorapatite, which makes them stronger and more acid resistant, where hydroxyapatite toothpaste will just put the hydroxyapatite back into the teeth. The final two steps then again are more rinsing. The first one is with an alcohol mouthwash, something like Listerine, and then using an ACT fluoride rinse. I've seen in a lot of other Dr. Ellie videos where she talks about the oral microbiome and how important good bacteria are and different types of good bacteria, bad bacteria, and how they all work together. Listerine as an alcohol mouthwash kills everything. So there's no way to promote the good bacteria from something like Listerine. I personally would skip that step. I don't recommend using an alcohol-based mouthwash, and especially not one like Listerine. The next step, the ACT or the fluoride rinse, again, I think is optional. You don't have to do it. If you're someone that is more prone to getting decay and cavities, then that would be a good extra step to have. It's in the right position as well. You should do it after you brush. If you're not able to get ACT, then Colgate make a very similar mouthwash. It's called FluoriGuard. Or if you want to stick with some of the Kin products that I was talking about before, then they have one that's called OrthoKin. It's also a fluoride mouthwash. It's intended for people who have braces, but it can be used by anyone. So one thing that I haven't talked about in this video is flossing. And controversially, Dr. Ellie doesn't recommend flossing. She says that it's optional. I personally disagree. I would encourage everybody to floss. The idea that floss can cause damage or cause trauma to your gums isn't far-fetched. If you're not flossing correctly, then yes, you will cause damage to your gums. And I've made another video about how to correctly floss your teeth or common mistakes with flossing. If it's done correctly, you will not be pushing bacteria back up onto your gum or further up onto your gum. I hope this gives some extra insight into this system and probably some other alternative products that you could use in a similar setup. I know a lot of people have gotten a lot of benefit from this system, and I think especially if they were coming from a place where they might not have been looking after their teeth particularly well before that. But I think that just goes to show that if you're consistently brushing and using other adjunctive dental products, that they do work, that you will get some improvement. Whenever we're talking about things like this, we are starting to look at finer details as to how you can really tailor this system for yourself.